popular procedures in the U.S. right now is breast augmentation, but you may be surprised to learn that not all implants are the same and procedures can be customized for each patient. So Dr. Stephen Davis joins us for a lesson in breast augmentation 101. Thank you so much for being here.
Oh, you're welcome. This is fun.
This is new territory for me. Clearly, you know, the girls are not like this. So let's get started. First of all, I always hear saline versus silicone. Which is better?
Actually, both. The FDA has approved both of them. The saline ones have been around since like 1960, but in 2006, the silicone gel implants became FDA approved, and it changed a lot of things. One of the most important things that I think people really want to understand is, why would you choose one versus the other?
Right.
And I think if you feel a saline implant,
this is saline.
Okay, and now I'm going to have you feel
like
silicone gel
right
away. So for people at home, it's difficult for them to understand that.
It feels heavy.
It does feel heavier, and I think rippling and the almost like it's water in a bag type of thing versus something that's really made out of a cohesive.
Got it.
So those are the two main things.
But in terms of safety, we've heard of the nightmares in terms of like silicone leaks and all of that. So is this in that case better?
Well, that's why a lot of patients right away will say, as soon as they hear the word silicone, they say
no.
I'd rather have the saline.
Right.
But these silicone gel implants now are made with a cohesive type of gel, almost like if you can imagine a gummy bear candy. So if you cut this in half, you're going to have two halves of this gummy bear. There's no liquid in here anymore.
Oh, really?
Okay, so this is the official gummy bear implant that I'll talk about in a second, but I brought something along as well that I really wanted you to take a look at. Would you believe that every one of these implants is the exact same size?
Is it really?
They are.
Do they come in different sizes?
That's the idea. So they come, years ago, there were only cc's that we talked about. So if one of your girlfriends got a breast augmentation and she got a 500cc implant and you love them, you'd say, I want to look like that. You'd come in, and regardless of how tall or short you were, that was the implant that you got.
And it would look weird.
Exactly. Now, what I brought along purposely is that you could see all these implants are the same size cc's, but this one's in a narrower bag.
Oh, right.
Notice that? So
it's
this is a 325cc implant, but so is this one.
But it's
so each one has a little bit higher projection, we call it. And the reason for this is very interesting. Someone that wants to have more of a lift. So let's say they've had a couple of children, and now their breasts have gotten a little bit more saggy.
Or they're like mine and they're shrinky dinks and non-existent right now. But anyway.
Dinks. Okay, so we'll use that term, all right? So they start to lose some of their volume, but the nipple starts to go a little further away from where you'd want it to be too, and that's why people call it like a drooping kind of a breast. You can put an implant in that has more projection, and it literally causes the nipple to be rotated up or lifted without doing any other surgery besides just a breast aug.
Interesting. So you mentioned the gummy bear thing before. Let's talk about that. It's not just a great candy, but
these are the brand new implants that have come out, and the great thing about this is they have a shape that it constantly maintains. So regardless of what you do with your body or how you're moving, this implant is always going to stay just like that, and it's a very natural look. It purposely has a textured surface to it, so you can feel that one versus something like this, and that's because it allows the patient's tissues to ingrow into that, so it will maintain that same balance, if you will. So someone that has a shaped breast that's really not so appealing, you can go with something more like a shaped implant and give you that nicer shape that you'd like.
So what's the difference between a lift and an augmentation?
Right. So if you're going to have a formal breast lift, what that really means is the patient generally has enough of their own breast tissue, but it's just being housed in a very low position.
Right.
So by taking away some of the extra skin, you can actually reposition all that patient's breast tissue in a higher location, take away all the excess skin, almost like creating a tighter skin envelope.
Wow.
Making that breast look like you had a breast implant.
But it's still your own.
Exactly.
It's all natural, if you will.
But it's a little bit more scars usually, and a little bit more of a surgery. So a lot of patients hope that they can accomplish both by using a specially kind of placed implant.
So if anyone's like me and hates needles and passes out when you see a needle even, what can you do to get that look without having to go under the knife?
So patients that have a really small type of breast, it can't be someone that's very heavy, but someone with a small breast that really wants to look like they've had a breast lift, we've come up with something, and they've been using it in Hollywood for a long time now during like the Academy Awards and things. You can have Botox injected into your chest area.
Wow.
And what that does is it puts the muscles in this area to rest so that your back muscles take
Sit up.
over.
Yeah, that's my mom's always telling me to sit up.
That's it. And it kind of looks like you had a breast lift, and all you really did was just allow certain muscle groups to kind of take over.
Wow. Well, thank you so much. This is the most I've felt of breasts ever in my life, even my own.